Hi there. As you know, national healthcare reform was signed into law on March 23, 2010. But did you know that many changes of the new legislation have already begun taking effect as of September 23, 2010? This video is provided to help make sure you're aware of some of the law's key changes that could impact you and your dependents right now or in the near future. Check with your employer or insurance advisor regarding which changes apply to your coverage and when they will take effect. It's also to note that some plans may be grandfathered from some of the law's provisions. So you should verify with your plan or employer if you have any questions about specific provisions that might affect you. Also, this brief video is just a summary of highlights and is not meant to provide a detailed description of every aspect of the law. That said, let's review some of the key aspects you need to know now. Under healthcare reform and non-grandfathered plans, many preventive services are now covered 100% with no copays, deductibles, or coinsurance. Some grandfathered plans may also cover preventive services 100%, but double check with your employer or plan. Under the law, your eligible dependents can now remain covered under your plan until they reach age 26. Insurance companies will be restricted on the use of annual dollar limits for the amount of insurance coverage a patient may receive, and there will be no lifetime maximum coverage limits any longer. Only a few exceptions have been made on this restriction through government waivers, but the vast majority of plans will have these limits eliminated. There are no pre-existing conditions limitations for plan members who are under the age of 19. This means members under 19 years of age cannot be denied health coverage due to pre-existing conditions and cannot be subject to pre-existing condition exclusions. There are additional patient protections that impact selection of primary care physicians in plans that require them. And under the law, women will now have direct access to OB/GYN care without the need for a referral or authorization. Policies can only be rescinded or canceled in cases of fraud or where a member intentionally misrepresents material fact. Beginning January 1st, 2011, if you participate in a flexible spending account, or FSA, over-the-counter medicines and drugs may be reimbursed only if prescribed by a physician. This change does not apply to medical supplies such as insulin and other healthcare expenses such as vision supplies and first aid items. So before heading off to the pharmacy to use your FSA funds, it's best to verify what the eligible items are. We hope this video was helpful in explaining some of the immediate changes that may impact you and your family under healthcare reform. Contact your plan or human resources department for additional information. Thanks for watching.